73-year-old Leonora Jernigan battles emphysema every day of her life. Most of the time, she feels like it's a battle she's losing.
It takes away your breath, it shortens your breath, it gives you an inability to do anything in motion, in that the least exertion renders you breathless.
Lenora has been smoking for more than half a century. Most days, she wishes she'd never started.
I still miss smoking. I have cravings. I smoked for over 50 years, but I guess it was a criminal offense on my part because I'm serving my time.
Lenora's sentence is emphysema, a disease of the lungs that makes the normally unconscious effort of breathing seem almost impossible. Her condition is also known as Chronic Obstructive Pulmonary Disease, or COPD. 90% of COPD cases are smoking-related, either through direct smoke or secondhand smoke. In fact, children who grew up in homes where their parents smoked are at higher risk for developing obstructive lung diseases like COPD, both in childhood and later as adults. In the 10% of cases that are not related to smoking, there is either a genetic condition that causes COPD or the cause is unknown. COPD, chronic bronchitis and emphysema, is the fourth leading cause of death in the United States. According to the CDC, in 2005, COPD caused an estimated 126,005 U.S. deaths in people older than 25 years.
The mortality rate for COPD is increasing every year, and there's no indication at all that it's going to decrease.
A major part of the problem is that chronic obstructive pulmonary disease is largely a silent condition, doing damage for decades without the patient even knowing anything's wrong. The natural history of the disease in smokers follows a clearly recognizable pattern. Here's a typical example for those who start smoking when they are young. At age 18, the lungs are grown and completely open. No damage is evident. By age 28, there is a consistent cough, sometimes called a smoker's cough. By the mid to late 40s, lung function is beginning to be seriously impaired, and there is difficulty breathing with some simple tasks. By the 50s, blue-collar workers can no longer work, and most COPD patients can't walk for long distances and can't lift objects. By the late 50s, early 60s, quality of life is severely impaired. Patients, assuming they continue to smoke, find they cannot perform simple activities of daily living without difficulty. Most longtime smokers with emphysema and chronic bronchitis die about 15 years earlier than they would have otherwise.
Later in this show, we'll take a look at a program showing some success in helping patients quit smoking. But just ahead, more about how chronic obstructive pulmonary disease develops and its early warning signs.